Ms. Rojas. My name is Josh Okowski. I'm actually a third-year medical student here, and I was actually asked to come in. I know you've had a few complaints, so I actually thought I'd come in and see how you're doing.
Well, I don't understand why I still have this lipoma on my shoulder, which is what I was supposed to, the surgery I came here for, and why I have stomach pain now.
Well, there is pain after surgery. You're aware of
On
that?
my shoulder? What? I was supposed to have this lipoma removed from my left shoulder. Why is my stomach hurting?
Well, your stomach is hurting because we removed your gallbladder.
You did what?
We removed your gallbladder. I believe you came in to...
I came in to have a lipoma removed from my shoulder. Why was my gallbladder removed? What?
Ms. Rojas, I'm not exactly sure what happened, actually.
Well, so you need to find out what happened.
Right.
I was not having any problems with my gallbladder. I came here for a removal of lipoma that was growing on my left shoulder.
Okay.
And you're telling me that somebody removed my gallbladder?
Yes, we had a very successful gallbladder surgery.
What do you mean you had a successful gallbladder surgery? I didn't come here for gallbladder surgery. What
sure?
is, my chart, I saw the doctor. I had a consultation with the doctor. He said, it's a very simple operation. It takes maybe 2 hours. We'll remove this. You'll be fine.
Okay.
It's still on my shoulder, and I'm having stomach pains, and you're telling me they removed my gallbladder?
Yeah.
How do you get from lipoma to gallbladder?
I understand why you might be feeling this way.
Lipoma, L, gallbladder, G. How can somebody make a mistake like that?
First of all, Ms. Rojas, I'm actually just a third-year medical student. I was in.
Don't keep saying
surgery.
you're just. They sent you in here. Obviously, you're not a just. They sent you in here to talk to me, so you must know something.
Well, I do. I was in the room, and I was just under the impression that you were having gallbladder surgery. I didn't
I
know
didn't come here
that
for
you
gallbladder surgery.
I understand that, and we're going to get to the bottom of this. Let me just explain
Well, you
to you.
You need to bring the doctor in here so we can get to the bottom of this.
We will bring the doctor in. He is in surgery at the moment. I'm not exactly sure how long that's going to be.
Oh,
but
God, I hope he's not taking somebody else's gallbladder out by mistake.
No, I guarantee he's not doing that. But
how do you know?
Let me just explain to you. I think what might have happened. You have a lymphoma there. We performed what we called laparoscopic gallbladder surgery.
How does lipoma? So it's stuck with laparoscopic or whatever you said. It starts with an L, but lipoma, laparoscopic gallbladder. How do you make that kind of mistake?
Right. There is a...
Who's writing these charts?
I'm not exactly sure who wrote this exact chart, but this is...
Well, we need to find out who wrote the chart. We need to get the doctor in here.
I agree.
And find out what went wrong.
I agree with you wholeheartedly. I don't know why this happened. I'm just, like I said...
I knew I shouldn't have had this. I should have just left this thing alone.
It's... keep in mind, we will be removing that. If that's
no, you won't. Why would I want to come back here and have someone else botch something else up? Why would I trust you?
Okay.
That's the problem. You get inferior insurance, they send you to a hospital. That's how minorities are treated.
I completely understand.
If I were at some downtown hospital, I wouldn't have been treated like this.
Mm-hmm. We're going to do the best we can to...
The best you can
this.
To what? Fix what? You're going to give me my gallbladder back? The gallbladder, obviously it serves some purpose in my body.
Well, actually, to let you know, we did remove your gallbladder, and...
Yeah, you keep saying that.
I know. I'm sorry.
I need it. It came with me.
Right. What I meant to say is that...
It serves a purpose in my body.
Mm-hmm. What I meant to say is that when we people who have their gallbladder removed for other reasons, cancer, whatever, they actually live regular lives. You'll be fine without it, so to speak.
How do you know?
Not that I know. I mean, I realize we made a mistake. I know because I've studied the statistics
You're
and everything.
student. Statistics, nothing. Who knows what's going to happen to me 10, 15, 20 years down the line?
Mm-hmm.
I might need my gallbladder.
Well, yeah, maybe.
Yeah, maybe. Yeah, right. Get somebody in here who can talk to me, who knows what they're talking about.
Well,
because you sound like you're making up stuff, and I want to know why this happened.
I guarantee you I'm not making up anything. We really are sorry. I had no idea. I was under the impression that we were having gallbladder surgery, and obviously a mistake was made, and we're going to make sure
I need to speak to my lawyer.
that you'll be fine.
I need to speak to my lawyer.
Well, I guarantee this doesn't have to be a legal issue. This is actually
This is illegal. This is my body.
Mm-hmm.
You've made a
Right.
mistake with my body. This is a legal issue. I did not come in here for this.
Do you need any water or anything at the moment?
Do I need water? What's water going to do? I have stomach pain. I don't need water.
Mm-hmm. Yeah.
I need to talk to the doctor, and I need to talk to my lawyer.
Okay. Well, this is what we're gonna do. If I can suggest, I'm gonna explain in detail what you told me, that you came in for lymphoma, and we accidentally performed a laparoscopic gallbladder surgery, and that we'll talk about it for a little bit, okay? And I'm gonna bring him in here as soon as he's done
Bring
with
him
surgery.
in here.
And that might take a
Bring
little
Dr.
while.
Butcher in here.
Are you gonna be okay if
What am I going to do? What do you mean, am I going to be okay? What can I do?
right? Okay, so we're gonna take care of this wholeheartedly, and I guarantee that we.
I don't know what take care of this means.
Well, let me just assure you that here at St. Barnabas, we are.
You're what?
We're want to make sure that you have the best medical care possible. We're not here to
Mistakes included, huh?
well, we're not here to make mistakes.
Well, you
I
did.
guarantee
You did.
I deeply apologize, Ms. Rojas. I really do. This is obviously an
This is
error that we made.
unbelievable.
You have 2 minutes
Unbelievable.
remaining in the encounter.
Unbelievable.
Like I said, is there anything I can get you? Is there some water? Is there someone I
I
can call
don't
for you
want
maybe?
water. Call the doctor. Call the doctor and bring a phone in here so I can call my lawyer.
No, but-
Those are the two things you can do for me. That's all I need right now.
But I just want to make sure that your safety
Oh,
is
just
okay.
wait till my
'cause,
husband hears about this.
Is your husband here?
Thank God he isn't. He burned the building down. You better be glad he's not here.
Okay, well we'll contact your husband and we'll make sure that you can get home okay. We want to make sure that you'll be fine. And in the meantime, I'll get you a glass of water. Or
I
something.
don't want any water.
Right, and then I'm going to talk to the doctor, and we're going to bring here, and we'll have another little chat, and maybe your husband will be here, and we can figure all this out, and then we'll go from there. How's that?
Just get the doctor in here.
Okay. Again, I'm very sorry what happened. I'm going to go and speak with. I'm going to wait for the doctor to get out of surgery, and then I'm going to wait for him. Okay. In the meantime, I'm going to get hold of your husband. Anybody else you want me to get hold of at the moment?
Just give me a phone. I'll get hold of my husband.
Okay, great. Okay, thank you.